Hello friends, I am Dr. Deepak Garg and today we will discuss portals in knee arthroscopy. So let's look at this picture. We will first, after the painting draping, we will first mark the surgical landmarks. So this is the patella that we mark, and this is the patellar tendon that we mark. This is a lateral joint line, this is a medial joint line, and this is a femoral epicondyle on the lateral side, lateral femoral. This is a medial femoral condyle, and this is a femoral epicondyle that we have marked here. So then we have the portal. So in this area we create a portal that is called the anterolateral portal. Similarly, on the medial side, in this area we create a portal that is called anteromedial portal. The portal on the lower side, on the lateral side, this is a low anterolateral. Similarly, on the medial side, it is called accessory low anteromedial portal. On the lateral side, on the lateral border of the patella anterior to the femoral epicondyle, this portal is a patellofemoral axillary portal. So these are the portals that we see on the anterior aspect of the knee. Similarly, if we look at the medial side, there are two portals. One is a superomedial portal, one is a posteromedial portal. So we will look about these portals in detail. Similarly, on the lateral side, there is a superolateral portal and the posterolateral portal. So we will look about these portals. So let's look at the about the anterolateral portal. So we already know from the patella, this is a patellar tendon, so it will be on the lateral side of the patella, and above the joint line we create this portal which is called the anterolateral portal. This is a primary portal in the knee arthroscopy. This is used for, this is known as a viewing portal. So we will put the scope here and we will use this as a viewing portal. So to look at the precise location when the knee is in 60 degree of the flexion, so this will lie at the inferior pole of the patella. So this is a anterolateral portal. This is the most common portal that we use in the knee arthroscopy. For the diagnostic arthroscopy also, this is the portal. Similarly, when we talk about the anteromedial portal, so this is the anteromedial portal. So this will lie medial to the patellar tendon and above this joint line. So the location of this portal will vary. So if we want to go towards the posterior horn of the medial meniscus, then we will try to take this portal more on the lateral side, just lateral to the patellar tendon, or we will see the anterior horn of the lateral meniscus and we will take this portal. And if we want to go to the lateral compartment, then we will like to cross the spine of the tibia, then we will tend to keep this portal on the superior aspect and more on the medial side. So this is how we can go easily. So depending upon the preoperative planning and the pathology, we will try to take these portals and as per the pathology. So this is how we take the anteromedial portal. Similarly, if we talk about the patellofemoral axillary portal, so this portal will usually lie at the junction of this lateral border of the patella and this anterior to the femoral epicondyle. So this is here where it will be located. So if the pathology, so this is on the lateral side, if the pathology is in this compartment on the lateral side, if the pathology is in the lateral meniscus, posterior on the lateral meniscus, the lateral gutter or the lateral compartment, then we will prefer this portal. So this is how when we use this portal in our day-to-day practice. So usually we use it less, but it can be used sometimes. So this was about this portal. Then we have the low anterolateral portal. So when we want to go directly on the lateral meniscus, posterior horn of the lateral meniscus, it will be difficult to go from this side. So then we can create a low anterolateral portal. Here we can easily go to the posterior horn of the meniscus as compared to the portals from the medial side. So in these situations, sometimes we may need anterolateral portal also. So this is when we create the anterolateral portal. So this was about the portals from the anterior side. Let's now talk about the superomedial portal. So this is a superomedial portal. Here we mark the full patella. Then we go 3 to 4 centimeter superior to the patella and then posterior to the patella. This is where we will start this portal. We will take a skin incision and then we will use the trocar and the cannula and we will try to go to the underside of the patella. towards the trochlear notch. So we are going from the medial side, so it will be easy to view the lateral side. So when we want to look at the lateral retinaculum, or sometimes the release of the lateral retinaculum or the lateral structures, then sometimes we use this portal. Similarly, if you want to talk about the from the lateral side, the superolateral portal, similar to the superomedial portal, we again come 3 to 4 centimeters superior to the patella, then posterior to this we create the superolateral portal. Again similar way we go to the with the trocar and cannula on the towards the trochlear groove. Similarly, we are going from the lateral side, so we will be looking more on the medial side. So medial retinaculum, we want to do something in the medial retinaculum, we may need this portal. So we should be aware about this portal. This is about the superolateral portal. Then this is the most difficult portal. There is a posteromedial portal. So if we want to create a posteromedial portal, then usually we will use a inside out technique. So we will come from the inside and then we will create a portal. So to understand this, we should know little bit about the anatomy. So this picture is showing this is a neurovascular structure. So this is a popliteal hiatus. So we should know the anatomy of the popliteal hiatus. These are the neurovascular structures. So this is a medial femoral condyle. So our portal will come somewhere from here. So this is very near to the neurovascular structures. So we should know in detail how to create this portal. So we should know about the insertion of the PCL. So this is the posterior cruciate ligament. This is the medial condyle. So if we come out from the gap between the medial condyle and the PCL and we are coming towards the medial side from the lateral side, then it will be safer and we will not injuring the vessels or the neurovascular structures. So this portal is created from the viewing portal on the anterolateral side. So we will put the scope in the anterolateral portal and then we advance the camera into the notch at the interval between the medial femoral condyle and the posterior cruciate ligament. So this is the same place, and then once we identify this gap, then we will replace the camera with a trocar, and then we keep the knee in 60 degree, around 60 degree of the flexion, and then we will trocar and sheath are gently advanced into the posteromedial compartment. And once we are there into the compartment, then we will replace the trocar with the camera and palpate the posteromedial knee with a finger. So then once we know the location, then we insert a spinal needle, we confirm it, then we take a skin incision, then we insert the trocar cannula from the same skin incision. So roughly to know about it, the location is 2 cm superior to the medial femoral epicondyle and roughly 1 cm posterior to this. So this is about the posteromedial portal. So similar to the posteromedial portal, we will create the another portal from the lateral side, that is the posterolateral portals. So there we come from the PCL and the medial epicondyle. Here we will come from in between. This is the ACL and this is a lateral femoral condyle, and this gap we will identify. Now we will keep the scope in the anteromedial. We will identify this gap. We again similarly we will may insert a trocar and then we palpate with the finger, and then we will insert a needle here and then trocar, skin incision, trocar and cannula, and then we can enter this posterolateral portal. So this is how we create posteromedial and the posterolateral portals. So this was about all the portals in the knee. So to summarize this, let's just have a look on the image in the first video. So this is our first slide. So again we first mark the landmarks, then we create a anterolateral portal, we do the diagnostic scopy, anteromedial portal. These are the two most common portals that we use. The another portals that we should know are the low anterolateral, low accessory anteromedial, and the petalofemoral axillary portal. Similarly on the medial side, superomedial and the posteromedial, and on the lateral side we should know about the superolateral and the posterolateral portals. So these are the knee portals that we use in the arthroscopy. So thank you for watching this video. Thank you very much. For more such videos, please like, share and subscribe to our channel. Thank you very much.